Hi, everyone. My name is Lisa. At my first internship, I worked at a local hospital in the town I used to live in. I worked on the oncology floor, so I worked with people who were getting chemo due to their cancer diagnosis. A lot of the people that I worked with were low income, so I helped them with Medicaid benefits and making sure that they had the health care coverage that they needed for their treatments. We also provided them with outside resources such as mental health services if they needed them. We had a food pantry. We also had monthly cancer groups with adults, and we had one with their children if there was a mom or dad dealing with cancer and their children couldn't deal with their feelings. We also had a monthly meeting with that. I went to cancer rounds with the oncology team, so it would be doctors talking about the patient's diagnosis and what kind of treatment that they should be receiving. I did feel, though, that as the social worker in the role, I didn't get a lot of clinical work at my internship. I felt like most of the time I was just making sure that people had food that they needed, they could get to their appointments, and doing these depression screenings. And then after the screenings, I just felt like that kind of didn't go anywhere. So I feel like in my next internship, I'm hoping to get more clinical work with the internship. And I'm hoping with these classes, it'll also give us more information on how to handle situations. In the book, The Clinical Social Work Practice, so far what I'm reading, I wish we kind of had an last semester with the internship, because it's just the importance of having a strong relationship with the supervisor. I kind of felt like towards the end, I was working on my own, so there wasn't too much interaction with the supervisor. And I felt like she also, too, didn't really have much to show me once I understood the job. I was kind of on my own. I mean, she was there when I needed her, but I'm just looking for more hands on and more learning from someone who's had much more experience than I've had. And I look forward to the rest of this class.